My name is Anne-Marie Lamp Galullo. I'm here to tell my story of my cancer journey, which began in October of 2019. I was diagnosed with estrogen-positive cancer. And I still remember getting the phone call from my doctor, Dr. Phillips, who I had been seeing since I was 25 years old. And he called me with the lab results. And he asked me if I wanted to come into the office or was it okay if he gave me some information over the phone? And I said, over the phone is no problem. He told me that it was cancer, and he said that he had a recommendation for where I could go to follow up. And so I was given Dr. Grumley's name and told to call the number and that they would help me and that they were great. And wow, they were so wonderful on the phone. They told me that they would go ahead and set me up for a clinic, and that the idea of the clinic is that I would come and meet with Dr. Grumley and then all of the team of specialists that would be involved in my cancer treatment. Medical oncologist would see me, the radiology oncologist would see me, and that I would just be in the same room. And then the doctors would come and go. So it wasn't 4 different appointments, 4 different days. So that was very helpful. When I first went in, Dr. Grumley went over the results very methodically. I believe I had to have another follow-up. I needed to get an MRI. And actually on the MRI, they found another spot of cancer all within the same line. And then at that point, I scheduled my first surgery. I met with Dr. Grumley. She explained to me again what they were going to be doing. My husband was also in the room with me at the time. Explained things in, layman's terms, used metaphors, analogies, that I could relate to. I also appreciated it because I'm an English teacher, but I really did feel comfortable that I did know, what was going on. So I had the surgery. Dr. Grumley, it was on the right side, so trimmed my areola and then pulled the cancer through there, including a lymph node. And what was interesting is only 1 lymph node was taken. And I said, well, how come only 1 lymph node was taken and not 14? And she had said, because the research shows that whether you take 1 or 14, that your treatment is still going to be the same, which I thought was really interesting. When I would go to some support groups and I would talk to them about, what my surgery looked like and the decisions that were made, people were really impressed that, modern research and then theories that had been debunked as old practice was not happening here at St. John's and with Dr. Grumley. So there I felt very thankful, because the reality is I would have thought, take more lymph nodes and that would make sense. So they did that, and then she did the other side, took breast tissue as protocol to biopsy it. But basically the same procedure was done here, just with making sure that my 2 breasts matched. And then basically I got, a lift. After my surgery, I went home, so it was outpatient. Dr. Grumley followed up with phone calls, the nursing staff, fully supported. It was just really wonderful. The pathology did come back that they did find cancer in the 1 lymph node. It also did come back that there was not clear margins. There was still some cancer, and they were able to go back in and then trim a little bit more. It was all about the preservation of the breast. And because I did have breast tissue to spare, the idea is to keep taking the layers versus taking a big, massive chunk to do a biopsy only to find out that you didn't really have cancer, except for maybe a millimeter. They also tested the oncotype, the DNA of my particular cancer, to see if I would be a candidate for chemo. And mine actually came back at 0%, which was rare, and Dr. Grumley did confirm. It is possible to have your oncotype come back as 0% for needing chemo. So then the plan of action was going to be radiation. I did have another re-incision after the second one. I believe that these were happening about 2 to 3 weeks after my initial surgery. So my initial surgery was November 13th. And then I believe my last re-incision was around the 22nd of December. The idea was to heal for a month, then start my radiation treatment. It was 6 weeks, 33 rounds. And after that, on my last day, it was March 3rd, 2020, I was declared cancer-free. I just continued to see Dr. Grumley, get my screens every 6 months for 2 years. And then recently, Dr. Grumley gave me the, okay that I don't have to come back for a year. When you're first diagnosed, I would call St. John's Margie Breast Center and I would sign up for the clinic. I really did not know that it would be as involved, that you have a medical oncologist and then you have a radiology oncologist. They found a need and then created a wonderful, wonderful program. And I think that's what's so great about St. John's. They do their research. They're willing to try new things and care of the whole person. And so I think that because of people's personal interest in this cause, you can tell that this program was designed as a result. And in fact, I ended up going to a breast cancer support group, or as my friend likes to say, it's called the boob group. We have a lot of stories and we have a lot of, different surgeries and I'm not kidding, but people literally lean in and they're like, tell me that again. And I remember when I first went in, the therapist that was working with us had to have me re-explain everything. When I went to go see one of the oncologists, radiology oncologist nurse, she said, how many lymph nodes did they take out? And I said, 1. And she goes, only 1? So I don't know, it's kind of cool because I feel like even people that are still working in the field, we're all still learning and growing together. So I think that it also makes St. John's Margie Breast Center unique, this idea of the clinic. And I know Dr. Grumley and her team are very collaborative. The way they took care of me, I felt like they knew me for a very long time. Everything when I first came into the clinic, and there was like a young intern and she was giving me this really cool binder of stuff, and then somebody else came in and wanted to know if I wanted water, and then they walked with me the whole time. And then also providing a resource for, my husband, who also had questions. When I come back, it's just been so wonderful to see everyone, the nurses, and there's not any question. They're just so caring. I just feel very blessed and thankful that I have great doctors, a great team, and also an institution that is willing to give the best care for breast cancer patients. I would recommend it to anyone because it will change your life.